Diabetes is a chronic metabolic disease that occurs when the pancreas cannot produce enough insulin or the body cannot effectively use the insulin it produces. In this video, I'll be talking about diabetes, the pancreas and its function, the role of insulin in the body, the types of diabetes, the consequences of high blood sugar, the symptoms, the treatment, the complications, and the types of tests required. Hello everyone, welcome back to today's video. I am Ness Bola and my channel focuses on everything health and wellness. So if this is kind of content you are interested in, keep watching. So what is pancreas? Pancreas is located behind the stomach in the upper left abdomen. It plays an essential role in converting the food that we eat into the fuel for the body cells. And this pancreas has two main functions, which are number one, the exocrine. The exocrine function helps in digestion, while the endocrine pancreas makes the hormone insulin, which helps regulate blood sugar. So what is the role of insulin? Insulin is a hormone that helps glucose from food get into the body cells to be used for energy. Consequences of high blood sugar. When the body can't regulate blood sugar properly, glucose builds up in the blood, leading to high blood sugar, which is hyperglycemia. So I'll be discussing about the main types of diabetes, which are number one, type 1 diabetes. Type 1 diabetes is also known as insulin dependence, juvenile or childhood onset. Type 1 diabetes is a condition whereby the body's immune system attacks and destroys the insulin producing cells in the pancreas. It is usually diagnosed in children or young adults, but it can also develop at any age. The exact cause for type 1 diabetes is unknown, but is believed to be a combination of genetic and environmental factors. So type 2 diabetes is a condition whereby the body becomes resistant to insulin, or the body does not produce enough insulin. This is the most common type of diabetes, and it mainly affects adults, but children can have it as well. Causes for diabetes type 2 includes genetics, lifestyle factors, that is, lack of physical activity, obesity, and age. Smoking, drinking alcohol are other factors that can lead to type 2 diabetes. There is no cure for type 2 diabetes, but it can be managed to prevent worst effects of type 2 diabetes. Gestational diabetes is another type of diabetes. This is the condition that develops during pregnancy. It is temporary. Yes, it's a temporary condition, and it usually resolves after the birth of the baby. Causes of gestational diabetes is hormonal changes during pregnancy, along with genetic and lifestyle factors. Those are the factors that triggers this condition. So what are the causes of diabetes? Too much glucose circulating in your bloodstream can cause diabetes. Insulin resistance. Type 2 diabetes is mainly results from insulin resistance. Insulin resistance happens when the cells in your muscles, liver, and fats does not respond as they should to insulin. Autoimmune disease. Type 1 diabetes happens when your immune system attacks the insulin-producing cells in your pancreas. Hormonal imbalances. During pregnancy, the placenta releases hormones that cause insulin resistance, and you may develop gestational diabetes if your pancreas can't produce enough insulin to overcome the insulin resistance. Pancreatic damage is another reason for diabetes. Physical damage to your pancreas from a condition, surgery, or injury can impact its ability to make insulin, resulting in type 3C diabetes. Genetic mutation. Certain genetic mutations can cause neonatal diabetes. Long-term use of certain medications can also lead to type 2 diabetes. Medications like HIV and AIDS. So what are the symptoms of diabetes? Polyuria, abnormal excessive urine. Polydipsia, abnormal excessive taste. Polyphagia, excessive hunger. Progressive weight loss, presence of infection. Cataracts, low libido, blurry vision, delay in wound healing, excessive weight loss, dehydration, slow healing sores, hot, dry skin, abdominal pain. How is diabetes diagnosed? These three tests can measure your blood glucose level. Number one, fasting blood glucose tests. This test allows your provider to see your baseline blood sugar level. You are advised to fast at least 8 hours before you run this test. That is, do not eat or drink anything except water, as food can greatly affect your blood sugar. Number two, random blood glucose test. Randoms means you can get this test done at any time of the day. Another test is gestational diabetes. To screen for gestational diabetes, providers order an oral glucose tolerance test, that is OGTT. The normal range for fasting blood sugar test is less than 100. The normal range for random blood sugar test is below 140. These tests are measured in mgdl, that is milligrams per deciliter. Complications of diabetes include heart disease and stroke, retinopathy, eye damage, kidney disease, foot problems including infections and ulcers, neuropathy, nerve damage, skin infection, increased risk of certain cancer, hearing loss, sexual dysfunction. How do we manage diabetes? Managing diabetes requires medications and lifestyle changes. Medications like insulin injections, metformin, or other medications to help control blood sugar levels. Lifestyle changes like eating healthy diets, focus on balanced meals with controlled carbohydrates, avoid sugar and saturated fats, exercise regularly, maintain healthy weight, regular monitoring of blood sugar levels. Do not smoke, limit alcohol intake, get adequate sleep. Thank you for watching today's video. Goodbye.